Hi, my name is Conrad Beacham. I'm the Deputy Head Orthoptist here at Blackpool Teaching Hospitals NHS Foundation Trust. I've been with the organisation for 20 years. As a Band 7 orthoptist, I have a dual responsibility as a manager and a clinician. My managerial role involves me working with my head of department, Kath, and we ensure that our clinics run smoothly and that we have the resources to ensure we have good clinical care for our patients. As a clinician, I share a similar role to orthoptists around the country. Orthoptists are allied health professionals. Our role is to treat, to diagnose and to manage binocular vision abnormalities, ocular misalignment, and also with children that are struggling with their visual development, we will intervene there also. I didn't always want to be an orthoptist. Like many people, I didn't know what an orthoptist was. I started out in life studying chemistry, and that led me into a sales job. But very quickly I realised that I didn't have the particular skill set to be a good salesperson. But thankfully I had friends that were studying orthoptics, and speaking to them drew me into the profession. And it was back to university, and 20 years later here I am, so I took the long way around. I love the people. I love my colleagues, are fantastic. I've got a great head of department, great colleagues, orthotic colleagues. Our orthotic technicians are fantastic, and the medical staff, which makes my job so much more easy. Also, it's the patients for me. I think it's a privilege to interact with patients. Often they're very vulnerable. I particularly enjoy communicating with the patients. It can be quite difficult negotiating with a 2-year-old if you're trying to get them to perform particular tests. And on the other side of things, you could be giving difficult news to a friend or a relative of a patient that had a stroke on the stroke ward. So it can be quite challenging, but if you were to get that communication across and the patient understands, or the relative understands what you're trying to tell them, then that can be very rewarding. I think it's the interventions that we can make. So for example, a child with amblyopia being a lazy eye, if we were to intervene in their developmental period and give them 2 good eyes, that's something they take forward for the rest of their life. For the rest of their life they'll have 2 good eyes because of that early intervention. Another example might be in the way that we work with our specialist consultant, Mr. Naylor, to help realign the eyes of a patient that might have a squint or strabismus. So to realign the eyes of a patient, that has profound psychological consequences for that patient. You'll see much happier post-surgery, and also you can give that patient functional binocular vision, whereas they didn't have that before. Within the department, we've already made a number of substantial changes. We've re-evaluated the way that we look after our stroke patients. The recommendations from a large service evaluation showed us that we need to be more effective in our communication, which we've done, and also increase our staffing, which we've also done. Recently, we've also broadened our vision screening service. We're now working in collaboration with our partners at East Lancashire Teaching Hospital to screen all children, preschool children, 4 to 5-year-old children in Lancashire County Council schools. So just maintaining those changes will be a challenge for us going forward. So I'm lucky enough to be involved in a master's programme, Leadership and Management in Healthcare. We are re-evaluating our service here, so any recommendations or initiatives I can bring from that, Kath, my head of department, and the trust, we're looking at that, and hopefully we can improve patient care.